Good day, podcast community. PeteKane here, Podcast Pete and lifestyle coach. And we have a special guest for you today. So, when you have pain, you always want to get rid of the pain. It's amazing how our bodies work. And we get a chance to get to know Dr. Candace in a way of her story, her journey. So, Dr. Candace, tell us who you are, what you do, and who you serve, and then we'll get into the podcast.
Okay. Well, as you said, I'm Dr. Candace Escalea. I grew up in Georgia. I'm a small town girl, grew up in middle and South Georgia. So I'm a native here of the state. And I'm a podiatrist, board certified. Actually started my own practice, Prestige Ankle and Foot Care, a little less than 2 years ago. I started it. I've been practicing for a little bit now, probably about 18 years now. It sounds like a lot now, but it's been about 18 years. But I've always kind of worked for other groups. Like I worked for other private practices. I worked for more of a corporate type medical setting at one time. And I enjoyed it. And I felt like I had a lot of reach, but it just something within me. I felt like I was somewhat restrained. Some things that I wanted to do for patients, I felt like I really couldn't. And I wasn't in the position to be able to make the changes within those organizations. So I kind of stepped out on faith. I said, I'm going to move back to Georgia. I was out in Texas. I said, I'll move back to Georgia, my home state, and I'm going to start this practice. So Prestige Ankle and Foot Care was born from that. So that's kind of my little journey as far as how I got the practice.
Yeah. I know from living in a senior community, the importance of the quality of our life through our feet. What can you share with our viewers? Just that journey, like why is the foot so important to the quality of our life?
Well, I think it's a kind of a two-part thing. And I think the first one is obvious. When your feet hurt, it's almost like everything hurts. Your feet are supporting your body. They're supporting your body weight. To move around, you have to be on your feet. So when people are in foot pain, it affects not just, hey, my feet hurt. It can affect, hey, I can't go to work. Hey, I can't do my daily activities within my house. Just get up and cook or spend time with family, friends, because I don't want to leave because I know my feet are going to hurt within a few minutes. The other part that I think a lot of people don't really realize is that a lot of times the foot is a window into your overall health. I've found so many patients that have things that they think are minute or maybe not that serious going on with their feet. And it's actually an indicator of heart disease. I've had indicators of diabetes, of course, that's a big one. Things like that. So, circulation issues, people don't realize, hey, what's happening with your foot is because your circulation in your legs is no longer adequate. So it can be a really, life-changing factor if you can actually, identify what's going on with the foot problem and determine something more systemic or overall within the body is actually occurring. And it can even save a life. You have heart disease, they now get treated for their heart disease that could lengthen their life. So it's really important.
Yeah, I remember this was years ago when I first got exposed to reflexology and all the pressure points that are on that foot. I was blown away when I saw all the things that foot controls in the body.
Right.
What do you see when you are looking at people and you're seeing these kind of issues? Has there been anything in the last few years that has been more prevalent than previous years?
I think, I probably feel like the identification of circulation issues, vascular disease has kind of improved over the last maybe 5 years. And I think I see it a lot more now too. I don't know if it's necessarily that it's more prevalent. It may be that we're having better tools to identify and that people are being more aware of it, that, deal with foot and ankle issues like myself. And we're able to get them to the source that they need. But I think that's the biggest thing. Most people know to look, the primary care doctors may look for issues as far as diabetes and that type of thing. But I think a lot with the circulation is a big one because, things hurt. And a lot of times with circulation, all you feel is pain. You may not see a change in the way your foot looks or anything that you can visually, identify, but it's just hurting. And just getting a good history and knowing that they're just having specific types of pain can automatically kind of put a light bulb in my head and say, okay, I need to check out this circulation. This kind of, makes me suspicious their circulation is not good anymore.
Mm-hmm. Let's go back a few years. Like, at what point in your journey did you want to start, leaning into this type of, I guess, service, helping people with their pain in their foot? Were you like growing up, did you think of the service part of helping people? What got you in to what you're doing right now?
So, when everybody's little and they say, what do you want to be when you grow up? I always said a doctor. I have never said anything aside from that. So I actually did what I said. But when it came to figuring out, hey, what exactly as a doctor you want to do? Because that's a huge field. It's not just, one or two things. What actually kind of got me into podiatry was while I was in undergrad, in New Orleans, I actually received information from podiatry school just because they knew who was pre-med and who, was going that track. So I actually shadowed a podiatrist and I just loved what she was doing. I think it was the fact that, somebody could walk in pain and leave immediately with some relief and having a sense of I'm a little bit better that quick was a big thing. The other thing is we do a lot. I think a lot of people don't realize how vast podiatry can be. We do surgery. So a lot of people don't realize that. We do, of course, office, but we do a lot of procedures in the office as well. And I like that variety. I'm one of those people that I don't need the same thing every day. I like to kind of see what's coming at me for that day. So just that a variety of surgical procedure-based care was really a big thing for me, and just the way I can immediately help someone feel better.
Yeah, there's something fulfilling about helping people with their quality of life because pain does disrupt the quality. What would you say, what is the biggest misconception that people have about podiatry and what you do?
I think the biggest thing is a lot of people think that we're pretty much doing like foot care as far as trimming toenails. I think they think that's kind of the gist of it. We trim toenails, maybe some calluses, maybe help a little bit with some heel pain. They don't really realize the full extent of what we can do. Again, the surgical part of it, we're all surgically, trained. After a certain point in time, they had all residents become surgically trained. So we're surgical, we're procedure based. I don't think that people really realize there's a lot that can go on with feet. We do wound care. We do, removal of skin lesions within the office. Just different things that I think people don't really realize happen in the feet, and a lot of people aren't identifying, hey, I might have a mole on my foot that could be cancerous. I need to get that removed. And they come to us and we can handle that. That's what we do. So I think that's the biggest thing, just thinking that we're more just strictly a toenail and trimming your toenails, your calluses kind of physician.
Yeah, that, there is that, because this was maybe 3 years ago, and I was starting my journey after a stroke, and I had to wear certain shoes that were more comfortable for just walking around, because I had a brace on for a while. And the physical therapist had referred me to a podiatrist that was close by that they had a good relationship with. But my question is, like, shoes, how important are shoes to the quality of what people are doing with their feet?
They're very important. They're a big deal. If you wear a bad shoe, now you can give yourself foot pain. If you're continuously wearing these bad shoes, as you hear, a lot of us women like to wear very high heels, very pointed toe shoes. With doing that over time, you can now kind of precipitate deformities of the foot, bunions, hammer toes, kind of promote those type things to happen. They don't realize things like tendonitis come from shoes. You wear a bad shoe, an unsupportive shoe, you can now cause yourself to have pain because your tendons are working too hard in your foot. That's seen a lot, especially with like the slides, the flip-flops, those type of shoes. Any shoe that doesn't stay on your foot on its own, that you have to kind of keep it on your foot because there's no back to the shoe, your foot is working double time. because it's now you're walking, but you're also subconsciously keeping that shoe on your foot. So now those tendons are working so much harder. And now you start to notice, hey, I'm starting to have pain around my ankle or around the bottom of my foot. What's going on? And a lot of times it's because of that shoe. So a shoe is a big thing. If you get a good shoe, it can help resolve pain. It can help prevent pain. And can even help prevent deformities if you're wearing an adequate shoe that fits your foot.
That's so good. Starting your own business is a lot harder than people think. It takes a lot of courage. So when you were thinking about starting Prestige, tell our viewers, like, what was that process like? What were you thinking about? And what was the one thing that you just didn't have any idea once you started it that you could maybe share with our community?
Okay. Yeah, definitely starting a business is a big deal. And sometimes it was overwhelming too, just trying to figure out every little thing I needed to do. So what I thought about, well, my first thing I thought financially, how can I start this business? What's the smartest way to start it? I didn't want to just put myself into a situation where now I'm in this big hole. It was one of the biggest things that I started off with. And that's partly why I started mobile initially, where I was going to maybe like some assisted living facilities, some home visits, just because the overhead was a little bit better, as far as that goes. Even when I got the business, when I started rolling as far as with the brick and mortar office, just things like with my x-ray machine, there were all these regulations, state regulations that I was not aware of, things that I just didn't know how to navigate. And I think the probably the best thing advice I got was actually from another podiatrist who had started her own practice. And she was like, of course you want to do as much as you can do in-house, but she said, if it's something that's important or you really have no idea about it, definitely, try to connect with someone who that's their specialty, because you don't want to mess it up. And you have to kind of give away a little bit because you'll become overwhelmed. So, I was able to find different connections that had more expertise in areas that I may not have had that expertise in, and getting them to come in and kind of help me with that. It took a load off of my plate, the stress that I was having from those things that I knew were difficult or I didn't know how to do. It helped a ton with that. So I think that was the biggest thing, just different little, regulations coming up that I needed to fulfill. However, not necessarily knowing the correct path to fulfill them.
That's so good. What would you say, like, we work hard when we're in our own business. How do you unwind? What activities do you like to do to kind of, I remember a golfer said that they like to fish, they like just, to get out of that pressure of having to perform. They like just to throw a rod over there and just see what do you like to do that kind of gives you that fulfillment that you get to enjoy when you're not working?
Well, I could say I love to fish, actually.
Yeah,
I do. I don't get to do it as much as I used to because I'm not right on the water. Like I used to live close. I was right on the water in Texas. I was in Corpus Christi, but that's one of the things I love. It's just so calming. But what I've done since I've been more landlocked, I've actually started doing a lot of trail walking. It's so calming just to even being out there by yourself, just walking a trail. It's quiet. You have time to kind of decompress. You see the nature, you're exercising too. So that gets your, blood pumping. But I love going on a walk, just it allows me to clear my mind. Other than that, I love hanging with my son. So that tends to be a big, decompress. He makes you forget about what you got to do at work, because he has his own world going and his world is the most important according to him. So that is a big source of decompression for me is my son as well. But I love to go out and be in nature.
Yeah. I had a friend, a person, I think about a week ago, and we were talking, she was in Montana. And so she's in the outdoors. And we talked about grounding, just taking your feet and ground yourself. Have you ever shared, or do you ever talk to people about, there's something magical about being outdoors, that's for sure. But actually letting our feet hit the grass and enjoy the connection to our earth. Is there anything to that you've kind of discovered in your professional journey?
That's a big thing. A lot of people do talk about the grounding. I don't necessarily, a lot of my population, unfortunately, I don't necessarily recommend it only because they have other issues that it might
Yeah.
actually be harmful. Like in my diabetics, my circulation issue patients, I don't want them to be on the outside barefoot and now, step on something and give themselves an infection. And then of course my pain, they usually need something supportive. They can't really do the barefoot. But I do have a lot of patients that do like the almost like the not their shoe where you don't feel much, to the shoe and it's your foot is pretty much hitting the ground. And a lot of people I've had as far as patients felt, really good with that. It felt like it helped them a lot. And that type of thing. But I think it just depends on the person too, what's going on with you internally, systemically, if you can do that and actually have benefit from it.
That's so good. What do you like most about the educational part of what you do? I know we talked before we went on about health fairs, senior centers. What do you like most when it comes to that part of your business?
I think I love the contact with other people and being able to give them some knowledge that will probably change their lives in many times, in many instances. It may seem trivial to some people. Oh, you're talking to them about maybe their nails or maybe their heel pain, but those things, like I said, can be life changing for people. Being in pain, you can't do what you need to do every day. You can't get up and go to work. You can't, be with your family and friends. And if I can give them a little bit of knowledge on how to try to help with their pain, maybe prevent it from worsening or preventing it from coming back, the quality of life can be just improved so much. So I think that's the biggest thing, just that contact with people and just hopefully being able to help them in some way that even extends into things that aren't necessarily related to their feet, extend to their family, extends to their, work life, things like that.
That's good. What do you think? Like, we have a lot of this, there's a lot going on with AI, and it's given us resources we never really had more than a few years ago. How are you using AI to help you in what you do with your practice?
The biggest way I'm using AI is definitely on my website. Just trying to connect with people. We're not always in the office. So if they call, a lot of times if it's after hours or the weekend, we may not be here to answer their questions. But with AI, I'm able to actually answer someone's questions. They may ask, a question at midnight, or, they're searching online on the weekend and they want to kind of get a little bit more information about what I do, my office, things like that, how to get in, how to make an appointment. So I've used AI that way a great deal. We're using AI a lot too in medicine with just even doing our notes. So it's like things like that is listening, is dictating for us, which helps us in the long term as far as our work-life balance. A lot of times the paperwork is the biggest thing when you're in medicine. You see a patient, but now you got to go home and document what happened. You want to be as thorough as possible, of course. So AI has helped a lot with that as well.
That is, what I go to PT Solutions and they switched to Epic, which is a chart, a lot of medical people. And she was saying that, anytime you learn something new, there's all these procedures you have to connect with. And, they have to do a lot of notes as a physical therapist and occupational therapist. What do you do to continue to grow and learn, that you could share with our community? Is there books, things you listen to? What does Candace do to learn and grow?
Well, I definitely always read. There are always constantly new articles, medical articles, treatments coming out. So I'm constantly reading and participating in webinars that are showing us new, techniques to treat different conditions, new equipment, things like that. Now we all are required to do continuing medical education. So we do
Mhm.
conferences every year just to, also stay current on what's going on. But just in between that, definitely the webinars that I do on my own. You just search them. They email you about different webinars, just to increase your education and just to know what's new out there. So that's the
Mm.
biggest way.
As a business owner, it's in raising your son.
Mhm.
Before you got into your own practice and now, what has changed in how you parent your son?
So, changed before and now. So he's still relatively young. He's only 8. So
Mhm.
he's not too old. I think the biggest thing is showing him. I think that he didn't see before is showing him leadership skills.
Mm.
Of course, I could tell him, and I would tell him before, but now he sees me running a business, and he'll ask questions, and he'll
Mm.
ask me, "Oh, so these are your employees, or different things like that he's never been aware of." So he's much more cognizant of what's going on with a business than he was before. So I think
Mhm.
that has changed since I started my practice. I've also, I think, just trying to make sure he's as independent as possible,
Mhm.
just because he's getting a little older anyway. And two, with me running a practice, a new business, it's a lot. It takes a lot of work, and especially on the front end, you have to do a lot, just to try to get it up and running. So I try to make sure he's as independent and can do what he needs to do for himself that he
Mhm.
can, but also letting him know that I'm still here, that this is not eliminating my time that I have with him. So
Mm.
just making that effort to say, hey, this is your time this weekend, or tonight is your time, that type.
Mhm. What would you say in building a practice and your team? What have you done that has worked that you could share with us? And what is the biggest challenge that you found that you didn't really see before you got into your own practice?
I think with the practice, the biggest thing that I feel has worked so far is just trying to, and it's hard, it's just trying to find good staff, and making sure that the staff has the same vision I have as far as how people should be treated, how I want things to look and run. I think that's the biggest thing, the biggest success for me. I have a lot of people that come in and they love my staff. They say, oh my gosh, they're so great. They're so nice. They're so caring. And a lot of people tell me I feel so heard. That's been a big issue. People say they don't feel heard in medical
Mhm.
settings. They feel like they were telling the doctor something and it just wasn't addressed, or maybe nobody said anything back, and they just feel heard. And I think just acknowledging people and letting them know, I hear you, I understand what you're saying, and I'm going to do what I can do for you, has been the biggest thing, and that's helped, especially with word of mouth with the practice.
Mhm.
One of the things you don't expect, again, I guess that would be outside of what I was kind of talking about earlier with just starting the practice, is just, I guess, just the admin part. There's administrative work, I think, when you start a practice, but just, the number of things you have to remember,
Mhm.
because you're, as me as the small business, there's only 3 of us in my company. It's me and then my 2 staff, my 2
Mhm.
employees. So I have to remember, hey, I got to pay this bill today, hey, this, license needs to be renewed this month. This, needs to be inspected this month. Just all this small
Mhm.
administrative things that you have to do. I think that's the biggest thing. But I think if you can stay organized, I'm a big list person.
Mhm.
I tend to, I have a year calendar that I kind of made myself, and I know what's due when. Especially things that only occur maybe once a year. So I think
Mhm.
that helps me a ton. Just trying to stay organized in that manner.
That is so good. What is Candace most excited about this year? Like we've turned the first of the year almost.
Mhm.
What are you most excited about?
I think I'm most excited as far as the business goes is just the growth. I
Mhm.
just, I've been working hard with, being in my community, going to health fairs, going to local events, different festivals, just getting myself out there. And I just feel that there's growth that's going to be happening.
Mhm.
I truly believe that. So I'm really excited about seeing it. and kind of seeing how my dream can continue to just flourish and just what it can ultimately be. You know,
Hmm.
it's a big deal. I was talking to one of my colleagues when I initially started the office, and I'm like, they were like, "Oh, she started the office this year," and I'm like, "Yeah, I started the office." And he's like, "No, that's a big deal. No, you should
Hmm.
give yourself credit." And I'm like, "You know what that is? You know, you downplay what you do sometimes,
Yes.
and you're doing it and you're in it, so it may not feel as like as much of an accomplishment as it really is, but it is. So I think just kind of understanding, hey, this is a big deal. Enjoy it, work hard, kind of see the fruits of your labor, kind of grow and see what happens. That's the biggest thing I'm looking forward to it as far as that goes.
That's beautiful. You know, a friend, a mentor of mine had shared a couple years ago, probably three, about anchoring ourselves in our wins. So every day I put my three wins because our brain is kind of will lean towards the negative things if
Right.
we don't kind of let our celebrate ourselves because we sometimes get, it's busy, we're out there
Hmm.
doing so much and we forget the things that are really making a difference. So I know I can go back to probably 2.5, almost 3 years of every day putting wins down. And it just kind of anchors me because when you have challenging days, you can always go back and look, and it kind
Right.
of gives you a different, you know, look at the day because running and building a business is not easy and
Right.
it'll test every ounce of us. But if we don't celebrate, we sometimes can forget all the things that we're doing. Do you have, like, when you're working on being the best Candace you can be
Mhm.
as a parent, as a business owner, as a friend, do you read? Do you have a routine that you like to to do that has helped you grow?
Um, yeah, I kind of, well, what I like to try to do is I think I like to try to take some time at least every week just to sit to myself, um, and think, of course, reflect on my week, but just think about all the good things that are in my life.
Hmm.
Again, the relationships I have, my family, my friends, even things outside of work, because like you said, you get so consumed with things in life, you get so consumed with the work, and again, negativity tends to try to, outshine the positive. And I think just trying to sit to myself, reflect on my week, reflect on the positive things in my life, what I've been able to accomplish in my life, the experiences I've had in my life. I think that helps me just remember, hey, it's not really that bad. Those things that
Hmm.
happen, yes, they're there, but don't dwell on it, and even things that may be coming up, sometimes you start to stress in advance. And I'm like, don't stress about things you don't need to stress about,
Hmm.
There's enough stress in this world to instead of adding more to your life.
Yeah.
And we're really blessed, to be here, just to have what we have. A lot of people don't have or aren't here anymore. So you
Hmm.
have to understand life is precious and just be grateful for every day that you're here.
Ooh, that's so good. Do you have a habit that you could share with our viewers that has honored you and given you something that, you know, we usually say like habits create outcomes. Are there any
Mhm.
habits that you could share with us that has helped Candace?
Mhm. Um, Habits. I think just maintaining, honestly, I think just trying to maintain, in one sense, my relationships, my personal ones, outside of anything business wise. Um, I'm blessed to have my mother still here in life. So she's a big influence on me. We speak literally every day.
That's so good.
And so just having her be able to just, sometimes just sit there with me on the phone. It's not even necessarily that we're talking about something.
Hmm.
It's just that makes my day just right. It just, that's what my day is about. So I know it's not really a habit, but
Yeah, I mean, you know what? I'll talk to people and they'll say, like, I'm so busy, and we'll be talking. And I said, they're busy being busy, but are they
Mhm.
busy doing the things that are important, like
Right.
talking to your mom, like having those meaningful conversations? Because it's real easy. The average person in America watches 4 hours of TV and scrolls 2.5 hours of like TikTok videos or social media. So
Right.
you look at 6.5 hours a day is consuming.
Mhm.
And we're born to create, like create a business, create an environment for your son, create friendships, and
Mhm.
we get away from it. It's real easy to slide into consumption, and
Right.
then we're more critical or judgmental of things. How do you stay in a mindset of being creative?
Well, a big thing, like you were speaking on the TV, I have really, probably the last few years of my life, I've backed off on TV. One, a lot of TV is so negative now. And I feel like when you want to have positivity in your life or just positivity in anything you're doing, you need to speak you positively. You need to be around positivity. So I
Mhm,
really just feel like, a lot of the negativity we see on TV, even online, you get online, you can start seeing things that aren't the most healthy mentally for us. So I'm not a big social media as far as like just scrolling kind of person, or posting every thing I do. But I use social media. I think it's a very helpful tool, but I also mindfully say I'm not going to be on there every day. I try not to as well be as focused on TV news, things
mhm,
like that. I think just trying to continue to read positive things, read positive books, things that encourage me, help me stay in that creative mindset,
mhm,
and just kind of, like I said, kind of being with nature too, just outdoors. I love to
mhm,
garden. That is
mhm,
so relaxing. So that's a big thing. You're just out there, it's quiet. You hear the birds or whatever little animal is out there, and you can just kind of relax. And it even sparks thoughts. I'm just thinking, well, what can I do? How can I make my garden more beautiful? Just things like that.
mhm.
So I think that's a big thing. I think we're too plugged in sometimes.
Yeah.
Just always online or on TV and things like that.
Yeah, well, I'm in the Rotary Club in North Cobb, and
Mhm.
there was a lady that came and what she does when her and her husband go out to eat, if they see a family like engaging and really having those meaningful conversations versus on our screens so much,
Mhm.
she'll she'll pay for their meal and give them a card just to encourage them to keep having those conversations. Because I've had two hernia surgeries, and they were usually older people, and I was
Mhm.
in the waiting room the second time, and there were 16 people. I counted them. I mean, 18 people, and 16 of them were like glued to their little device. And I'm going like, dang. And I don't do any social media. And I've just gotten away from screens because I used to have a digital marketing business. And it has honored my brain like an
Mhm.
incredible way to not have that part of my life, because it's so easy to just be glued to a device. I have
Right.
one final, I want you to tell, I have one more question, but I want you to tell our viewers, how can they get a hold of Candace?
All right. So, one, you can visit my website. That is www.prestige, prestige, anklefoot.com. You can also call my office. The number is 678-370-0970. I'm on Facebook. So I do some social. I'm on Instagram too. So Prestige
Mhm.
Ankle and Foot Care LLC on Facebook and on Instagram as well. So yeah.
Awesome. I want to encourage our viewers, share this with people that can be serviced and helped by Candace, and how she approaches her business. Let people know. We want to make sure she can see the right people that need her when they need her. One final question.
Mhm.
What would be the one thing you want our viewers to take home from our time on this podcast?
I think just take care of yourself. I know we take care of a lot of people. We look out for family, friends, our children, things like that. But if your body's giving you pain, or if you just feel something's not right in your body, listen, because it's telling you, it's talking to you. So I feel like if we're proactive with our health, we can now help other people. If you're not proactive, you're not, making sure you're okay, you can't reach out to anybody else. So you have to take care of yourself. Listen to your body.
That's so good. Dr. Candace, thank you so much for
Thank
spending
you.
time with our community this morning, and we appreciate you very much. We thank you for
Yeah.
sharing.
Thank you.